Croup refers to an infection of the upper airway which obstructs breathing and causes cystic barking cough. The cough and other signs and symptoms of croup are the result of swelling around the voice box, which is larynx, windpipe, which is trachea, and bronchial tubes, which are bronchi. These are the upper respiratory pathways. Okay. When a cough forces air through this narrowed passageway, the swollen vocal cords produce a noise similar to seal barking. Likewise, taking a breath often produces a high-pitched whistling sound, which is known as stridor. Okay, croup typically occurs in young children. Croup usually is not serious and most children can be treated at home. Now let me tell you the symptoms. Croup often begins as a typical cold. If there is enough inflammation and coughing, a child will develop loud barking cough that is further aggravated by crying and coughing, as well as anxiety and agitation, setting up a cycle of worsening signs and symptoms. Fever also can be a symptom. Hoarse voice, breathing that may be noisy or labored. Okay, symptoms of croup are typically worse at night and usually last for 3 to 5 days. If your child's symptoms are severe, worsen or last longer than 3 to 5 days, or are not responding to home treatment, you should contact your child doctor. You should seek immediate medical attention if your child makes noisy, high-pitched breathing sounds both when inhaling and exhaling, makes high-pitched breathing sounds when not crying or agitated, begins drooling or has difficulty in swallowing, seems anxious and agitated or fatigued and listless, breathes at a faster rate than usual, or if he or she struggles to breathe, or develops blue or grayish skin around the nose, mouth or fingernails. And then this is known as cyanosis, so this can be a serious thing. So in that case, the symptom which I have just told you, a severe symptom, in that case you should contact emergency. Okay. Now let me tell you the causes of croup. Croup is usually caused by a viral infection, most often a para-influenza virus. Your child may contract a virus by breathing infected respiratory droplets, coughed or sneezed into the air. Virus particles in these droplets may also survive on toys and other surfaces. If your child touches a contaminated surface and then touches his or her eyes, nose or mouth, an infection may follow. Let me tell you the risk factors. Most at risk of getting croup are children between 6 months and 3 years of age. Because children have small airways, they are most susceptible to having more symptoms with croup. Now I should tell you the complications. Most cases of croup are mild. In a small percentage of children, the airway swells enough to interfere with breathing. Rarely, a secondary bacterial infection of the trachea can occur, resulting in troubled breathing and requiring emergency medical care. Only a small number of children seen in the emergency room for croup require hospitalization. Now let me tell you the preventive measures. To prevent croup, take the same step you use to prevent colds and flu. Okay. Nowadays there is a corona pandemic, so the preventive measures are almost same like corona. Okay, and that these are frequent hand washing is the most important. Keep your child away from anyone who is sick. Encourage your child to cough or sneeze into his or her elbow. To stay off more serious infection, keep your child's vaccinations current. Diphtheria and Haemophilus influenza type B vaccines offer protection from some of the rarest but most dangerous upper airway infections. There is not any vaccine yet for para-influenza virus. There is no vaccine for croup, but I'm just saying that you should keep your vaccine record updated and you should not miss any vaccination. Okay. Now let me tell you the diagnosis of croup. Croup is typically diagnosed by us. Okay. And when patients come to us, we observe your child's breathing. We listen to your child's chest with the stethoscope. And also we examine your child's throat. Sometimes X-rays or other tests are used to rule out other possible illnesses. Okay. Now let me tell you the treatment. The majority of children with croup can be treated easily at home. Still, croup can be scary, especially if it lands your child in the doctor's office, emergency room, or hospital. Treatment is typically based on the severity of symptoms. Now let me tell you the comforting measures. Comforting your child and keeping him or her calm are very important because crying and agitation worsen airway obstruction. Hold your child, sing lullabies or read quiet stories. Offer a favorite blanket or toy. Speak in a very soothing voice. And now let me tell you about medications. If your child's symptoms persist beyond 3 to 5 days or worsen, your child's doctor may prescribe these medications, which I should tell you now. A type of steroid, which is glucocorticoid, may be given to reduce inflammation in the airway. Benefits will be typically be felt within a few hours. A single dose of dexamethasone is usually recommended because of its long-lasting effects. Another medicine which can be used sometimes is epinephrine, which is also effective in reducing airway inflammation and may be given in an inhaled form using a nebulizer for more severe symptoms. It is fast-acting, but its effect wear off quickly. Your child likely will need to be observed in the emergency room for several hours before going home to determine if a second dose is needed. Okay. For severe croup, your child may need to spend time in a hospital. In a rare cases, if your child develops serious symptoms, then he or she may need hospitalization for further management. Now, let me tell you some lifestyle and home remedies for croup. Croup often runs its course within 3 to 5 days. In the meantime, keep your child comfortable with a few simple measures which I am going to tell you now. First of all, you should stay calm, comfort or distract your child, cuddle, read a book or play a quiet game because crying makes breathing more difficult. You should cuddle your child because if he or she is crying, then there may be more problem in breathing because of the narrowed upper airways in young children. Okay. Also, you can provide humidified air or cool air. Although there is no evidence of benefit from these practices, many parents believe that humid air or cool air helps a child breathing. For moist air, you can use a humidifier or sit with the child in a bathroom filled with steam generated by running hot water from the shower. If it is cool outside, you can open a window for your child to breathe the cool air. Hold your child in a comfortable upright position. Hold your child on your lap or place your child in a favorite chair or infant seat. Sitting upright may make breathing easier. Offer fluids. For babies, breast milk or formula is fine. For older children, soup or frozen fruit puffs may be soothing. Encourage rest. Sleep can help your child fight the infection. Try a fever reducer. If your child has a fever, over-the-counter medications such as acetaminophen, which comes with the name of Tylenol, may help. Okay. Skip the cold medications. Over-the-counter cold preparations are not recommended for children of any age and can be harmful in children less than 2 years of age. Plus, non-prescription cough medication won't help croup. Your child cough may improve during the day, but don't be surprised if it returns at night. You may want to sleep near your child or even in the same room so that you can take quick action if your child's symptoms become severe. So this was my video about croup. I hope you have liked this video. If you have any questions or comments about this illness or any other illness, if you are suffering, please comment in the comment section of this video, and I'll try to make a video about your illness. Okay. And if I don't find a time, then I always reply to almost all comments. Okay.